आज हम डाइजेस्टिव सिस्टम के बारे में थोड़ा बहुत जानेंगे। जब हम खाना खाते हैं तो कितनी बार चबाना चाहिए आपको ताकि पचने में अच्छा हो जाए? तो दैट इज़ 32 टाइम्स। वाई वी हैव गॉट 32 टीथ्स? Just remember this. 32 times you have to chew whenever you eat anything, and then it will come into the esophagus. See to that when you are swallowing, you don't talk much, otherwise it will go into the trachea and in the lung, and then you get a lot of cough and cold and a lot of cough. So the reason is that it is not allowed to put any particles in this trachea. Now this digestive fruit swallow comes into the esophagus, it will go into the stomach, and in stomach it will remain for a longer period, like half an hour to 1 hour, depending on what you eat. This is very also important, what you eat. If it is meat and all that thing, it will take a long time to digest. Though a lot of acid is here, it takes long time. Now I will like to put a stop over here, because when you eat and your stomach is already full, you don't feel hungry, and if you put something else, then it is bound to come out through this. We call it esophagitis. Most of the scopy done find they tell you esophagitis over here, this region. And hiatus hernia also takes place after a long time because of the esophagitis. That stomach comes into this region. So this is a stomach which comes out. And so when you are hungry, then only you eat. This is very important part. Once that is got digested, it will come into the duodenum part, which is hidden a little bit here. You can see duodenum here, much better way. The stomach part, and this comes into duodenum. Once it comes into duodenum, that time this gallbladder will push juices which is collected over a period of time from the liver into this duodenum, and then from duodenum it will go into the small intestine. Now from this small intestine it will remain for a longer period depending on the digestive system, how it acts. From there, lot of things will come into the large bowel. And here is the appendix. You can see this tiny appendix. Yes, if there is anything which is getting stuck here, then it will lead to appendicitis. For example, fish bone. Sometimes fish bone gets stuck over here and you get appendicitis acute. Once food particle comes into large bowel, the only thing remains is to absorb water from here, and then it gets accumulated over here, and when it gets accumulated you get the sensation and it passes the stool. Now very important that how you manage your rectum. Do not force. Simple. In rectum, when things are coming out from here, you have to not force, otherwise these blood vessels which are here next to it will come out and work as a piles. Or sometimes it may cause fissures over here. Or sometimes it may then lead to the fistula in ano, tract. So the stool comes outside the anus, other part. So these are all that you must remember while you pass the stool. Now coming back to the large bowel, it absorbs all the water particles from here and make it dry enough. Depending on your water content of the body, this will get absorbed here. If it is very much less, then the stool will be very hard. Yeah, that is one of the most common reasons why people get constipation. They drink very less water. Okay, water will be conserved by kidney also, but here is the function of the large bowel to conserve it. Lot of things I want to talk about this large bowel. That when you eat lot of chemicals, that is antibiotics and unnecessary medicine, that is chemicals, they make large holes in this large bowel so that they can get absorbed very fast. But these large holes which are created in the large bowel remains there, and so bad fat which is removed by your small intestine into the large bowel to throw it out will remain here for a longer period and get absorbed through this large bowel. That is known as bad fat absorption. Now you know why your bad fat get absorbed and you become more and more fatty liver, and your under the skin lot of fat get deposited from here, because this is not properly maintained. Maintenance is very important. Let us come to this part of the small, what you see behind the stomach, that is known as pancreas, and this gallbladder about. Let us talk about it. If you go in detail, that bile when comes from here and comes into the duodenum part, same way pancreatic juice also comes like this into the duodenal part. I will talk to you the importance of this bile duct joining here with pancreatic duct. Very important. I will tell you about it totally in different session. Now coming to this small bowel and the large bowel, most of these are innervated by the nerve called 10th vagus nerve. So whenever there is a mental tension, this vagus nerve does not properly pass their stimuli to large bowel and you may get constipation. So your brain is very important in this case for causing constipation, besides what I have told you about other things. Can you see these salivary glands here and here? When you chew for 32 times, these are sufficient enough to digest most of the elements that are in food, especially glucose, that is getting digested fast when it comes to the stomach. So stomach have to work less to digest it. So now let us begin with teeth. The first organ of digestive. Unless you chew properly, it will not digest properly. That's why teeth are very important. All teeth, 32. I sometimes used to laugh at my dentist friend that you have got 32 patients with you in one, while we get only one patient because everyone has got one liver and one stomach and one intestine and all that thing. You have got 32 patients because every teeth of this requires a separate care. If I tell you that what you are doing with everyday morning, brush, agreed, you do brush, but without toothpaste. You will wonder what is this without toothpaste? Yes, it is without toothpaste because toothpaste has caused all the problem. If you see the skull which has come out from the very old digging, where 200-year-old skull, they are all with the tooth. And if you find the age of that person who died was around 100 years, 120 years, how the teeth are still there? It doesn't fall down easily. And today, just in 40 and 50 years, you see so many people with the gone out. May have false tooth, may have gold tooth, now imitating tooth with screw, tooth on screw. I have myself so many screws with tooth fitting. You must wonder, now I came to know why it is occurring. It is the main cause of toothpaste. So brush it, but without toothpaste. Yes. This typical one tooth where you can see what tooth requires is the massaging of this gum, and no food particles should stay here. So proper gargling is also important. And this tooth which supply with nerves here, sometimes we do root canal. This is a root canal that we do, all four. And so you don't get sensation, but there is a cap artificially we keep it so that it does not hurt tooth further. But if you do massaging of your gums every day morning with your finger, after eating anything in your mouth, after putting anything, just gargle it out and massage your teeth. That's all. And throw out those water which is there, or you can drink it also, no problem. But do it with your hand. No toothpaste. Toothbrush, yes. Toothpaste, no. Let us come to the tongue part of it. The most sensitive organ on the earth, if you find, is the tongue. A lot of nerves are attached to here. The moment you put something, it immediately stimulates your brain. If tasty food is there, you feel great because it has got large presentation on the brain. Tongue has got the largest presentation on brain, and that's how when you put something on the tongue, like homeopathic drug, very small, they have got only atoms in that drug, that is pills. It directly affects your brain. Remember, from here, this is the organ. That's why most of the people ask to keep homeopathic medicine on the tongue for a longer period of time to make it action, and not to eat tobacco or anything else, so that tongue remains clean to absorb this atomic for stimuli properly. Yes, buccal carcinoma is very common in India, very common, and that's why I'm very much interested in this part of the body. that is mouth. Dentists can see all these things, and dentists are the first to diagnose cancer of the mouth, and there should not be any hindrance in diagnosing it. Please, all dentists, when you see teeth, also look for the malignancy. Okay, because sometimes they say that bad teeth causes cancer. It is not. The bad teeth is because of the tobacco and something like that, which is kept in the mouth for a longer period of time. Yes, that is the cause of, main cause of the, root cause of the buccal carcinoma. These are the salivary gland, parotid, submandibular, sublingual, three salivary glands. God has given three salivary glands on both the sides. Why? Because you have to digest in mouth. 32 times chewing. Remember, boss, 32 times chewing.